76,000 women were studied during pregnancy. Their fiber intakes were studied, and low fiber diets were associated with more than 50% risk of a developmental delay. If you're vegan and you're breastfeeding, your baby's not getting enough nutrients. That's not true. It's been proven. The studies I read said they expect 1 in 3 children to become diabetic by the age of 12 in the next couple of years. So hopefully.
Our next speaker is Dr. Jennifer Prabhu, and she's going to speak on the subject Veganism and Child Health. She has children who are plant-based. And so she's going to give a very clear medical evidence about how children can be on a plant-based diet.
Good afternoon, everyone. Thank you, Dr. Rupa. So this is a subject very close to my heart as a pediatrician and as a parent. So hopefully we'll convince anyone that has any doubts by the end. So I just wanted to start with some myths that I'm sure any parents or anyone that has or nieces, nephews, you may have heard if the kids are vegan. You've probably heard these before. You'll hear vegan kids are tiny, they're weak, they have brittle bones, they're always sick, they're anemic, they have lots of vitamin deficiencies. Everyone, not just for kids, you always hear vegans have protein deficiency. And then finally, hopefully not as much here, but in the US we used to hear all the time, feeding your children only plant-based foods is actually a form of child abuse. This is a quote from, as a pediatrician trained in the US, this is my government, the American Academy of Pediatrics. And they came out with a statement, I think 3 years ago, clearly saying that well-planned vegetarian and vegan eating patterns are healthy for infants and toddlers. And this was a really big deal in pediatric world because until then, and in medical school, we were always pushed to give milk, dairy products, especially in the first year of life. And it was drilled into our heads in medical school. So once this came out, finally, there was some light on a plant-based diet for kids. So it was very exciting. So we'll go through the first 18 years of life and how a plant-based diet is healthier and is, of course, safe for children from embryo to college graduation. So starting with pregnancy, we heard a lot of negative things about veganism in pregnancy, but you don't hear the negative aspects of being an omnivore, being a big meat and dairy eater. And actually there's a study, I think it was 76,000 women were studied during pregnancy. Their fiber intakes were studied, and low fiber diets were associated with more than 50% risk of a developmental delay. So cognitive development, fine motor, gross motor skills were all delayed in more than 50% of women that had a low fiber diet versus those with a high fiber diet. So that's a big number. Also, we talk a lot about omega-3s, how important fatty acids are. So yes, you can get those from fish, from fortified dairy products. However, a plant-based diet contains everything you need for healthy omega-3s. The ALAs are converted into omega-3s, particularly DHA and EPA, which are very important during pregnancy for a baby's brain development. Another pro of being plant-based during pregnancy is there's actually a much lower risk of gestational diabetes, which is just like type 2 diabetes is on the uprise in the population. It's related to a couple things. So one is the amount of weight gain is less in a woman that follows a whole food plant-based diet during pregnancy, so that is a reduced risk of developing gestational diabetes. And they also found that a woman that followed a whole food plant-based diet even prior to conception made it even less likely that she developed gestational diabetes. So that's gestational diabetes is associated with large infants that have blood sugar problems. They can get injuries during birth, so it's a really big problem in pediatrics. So that risk is nothing to be taken lightly. And then finally, again, this is for all pregnancies, but particularly women that are vegan need to pay special attention to vitamin B12 supplementation, and all pregnant women for folic acid. So those are the two big ones to look out for in pregnancy. And then just specific dosages in case anyone's interested. B12, folic acid, this is for everyone. So general literature recommends 400. I tend to recommend 800 micrograms just safer because low folic acid is such a big problem, neural tube defects, spina bifida, that sort of thing. Vitamin D, again, a lot of people will say 2,000. I tend to recommend more 4,000, sometimes even 6,000, depending on the diet of the pregnant mom. Iodine, we just heard a lot about. If you have iodized salt, you don't need to take extra iodine. So most people probably don't, but just something to keep in mind, important for baby's thyroid gland. And then I just mentioned the omega-3s. All right, so moving on to the newborn period. This is the first 6 months or so. And also when we talk about newborns, we talk about breastfeeding and breast milk too. So this is another interesting study. Let's see. This was in 2020. They did a huge study, a randomized control study, looking at the breast milk composition of vegan, whole food, plant-based moms versus omnivores and vegetarian moms. And they did mass spectroscopy, specifically looking at the components, and the important components were equal. So there's a lot of press that says, if you're vegan and you're breastfeeding, your baby's not getting enough nutrients. That's not true. It's been proven. Two of those components that are very important in breast milk are carnitine and vitamin B2. There was some debate about this a couple years ago, especially carnitine levels. But again, if you're on a well-rounded whole food plant-based diet, your breast milk should be more than enough for your baby's health. Vitamin D is something that's very important for any breastfeeding mom, but particularly a whole food plant-based breastfeeding mom. So either mom takes the vitamin D and it goes into the breast milk, and the dosing of that is again 4,000 to 6,000 international units. For baby, you can also do vitamin D drops if mom is not breastfeeding. Again, more calcium, iron, iodine, B12, those are all adequate in a whole food plant-based breastfeeding mom. And just another plug for soy. If you were here yesterday, you heard my love for soy. Soy formula is safe. Soy is not going to feminize your male babies and cause cancer later on. So if you cannot breastfeed, don't feel bad. Fed is best. I say that to all my patients. You can do soy formula instead of the traditional milk-based formulas. All right, so late infancy, this is 6 months to 12 months. Big thing here is introducing plant-based solids. But if you're doing whole food plant-based kids, then you're going to introduce plant-based solids. And for most babies, that's around 6 months. Some babies, like our little one, was more interested in 5 months. You have to talk to your doctor about the developmental readiness for that, but usually around 6 to 8 months is when we start solid food. This is, of course, continuing breastfeeding or continuing formula, so you're getting your D and B12 that way. This is not necessarily related to whole food plant-based, but I just want to talk about the second point here. So in Israel, there's a significantly less risk or incidence, of peanut allergy. The percentage is incredibly low compared to the rest of the world. In the US, everyone has an allergy of some sort. So coming here has been very refreshing. And I think probably it's for the same reason. So introducing possible allergens like nuts, berries, sesame, things like that, as early as possible allows the body to be exposed to it more and less risk of recognizing it as foreign later on. So very important. And of course, I would recommend introducing plant-based allergens. Another thing on here is, again, so basically you want to start, even before they turn a year old, introducing them to a wide variety of plant-based foods. The earlier they're introduced to different colors, different textures, different flavors, that will develop their appetite later on, and they'll have a more diverse diet. The whole overriding theme of my talk is diversity and including as many foods as possible so the kids are as healthy as they can be. So something called baby-led weaning. Of course, this needs to be monitored by parents so they're not choking, but you have actual pieces of food instead of pureed food. You can put them in little nets, I guess. They have this little thing that we used for our kid. It was a little net, and we put a banana or something, and they just hold it and eat it, and they kind of suck and learn how to eat more solid foods earlier than just purees. So that is another way to introduce textures earlier, and it's a really good concept. Just has to be done correctly, so always talk to your doctor about that. Okay, so moving on to ages about 1.5 to 4 before they enter big school. So everyone that has had a kid knows that toddlers are small and picky, but they actually this is an important time in their development. Their brains are still developing rapidly. So, it's very challenging to feed a toddler properly, but it can be done. And like I mentioned in the previous slide, starting early with introducing a variety of foods. Oh, one thing I do want to mention, it does take, so a lot of times with an infant, when you introduce a new food and they spit the peas back at you, try it again. Try it 2 times, 3 times, 5 times. It takes up to 5 times for a baby to get used to the taste of something. So I know it's frustrating, but don't give up. Most times they will accept it. Most times. Anyway, so similar with toddlers and preschoolers also, just keep trying in different ways to introduce new and diverse foods to them. Contrary to an adult diet, high fat and high carbs, and I'll show a graph soon about this, but they need a lot of fat and a lot of carbs in their diet for proper development, for getting ready for school, for their intelligence, their cognition. Of course, I recommend whole food plant-based of both of them, so less processed, so good fats you're getting from nuts, from avocados, good carbs getting from whole grains, that sort of thing. You're not going to be able to have all of your nutrition in 3 meals a day. Kids love snacks, so healthy snacks, dry fruits, berries, fruits, as many fruits as they want. Most kids like fruits, so please don't limit the amount of fruit you give them. They're getting so many good things from that. Drinks, this is not necessarily related to veganism, but water or milk, and that's milk with a Y, so plant-based milk, soy milk, almond milk, that sort of thing. No juice, or very limited juice. Juice will fill a kiddo up, they won't eat proper meals, and it's basically just refined sugar. So try to limit or not give juice at all. As with infants as well, calcium, iron, vitamin D continue to be important during this stage. B12 also, you will probably have to supplement your children with B12 at this point. So again, talk to your doctor about what is a safe dosage and what is a safe way to get B12 into them. So this was what I was talking about, their fat and calorie needs. So if you look at the daily fat grams recommended, I'm not sure why there's so much, the difference between the sexes to me doesn't matter, but I mean, that's 50 grams of fat, and in an adult, it's similar, it's like 55 to 60. So basically the same amount of fat that's recommended for an adult is for a young child. Same with carbohydrates. Actually, carbs is more than what's recommended for an adult. And contrary, or the opposite of that is protein. Everyone's obsessed with protein, especially with vegans, but 17 grams is not that much. You can easily get that from a whole food plant-based diet. Okay, so school age. This is where you start to see, you've been, training your kiddo and feeding them and working really hard to help them stay healthy. This is where you'll start to see kind of the difference between a kiddo that's raised on an omnivore diet versus a kid that has been raised on a plant-based diet, because this is unfortunately where these lifestyle diseases start to show up, is in this age group. And they're getting younger and younger. I actually, maybe it was pretty long ago, 5-6 years ago in the US, I diagnosed a 15-month-old with type 2 diabetes. So they're getting younger and younger. So any child that is on a well-balanced whole food plant-based diet has a much less risk for diabetes, for asthma, for Crohn's disease, celiac disease, thyroid disease. The list goes on and on. You start to see these things developing early and earlier, but not if you're feeding your child properly. Another big thing, especially in school, is the issue with milk. I think in the US is probably the same as here. Kids get milk on their lunch tray all the time. So usually plant-based kids have a better immune system, less inflammation overall. means their immune system, instead of, the cells aren't sent to joints or obesity or skin problems, the immune system is ready to go because there's a lower overall level of inflammation. So these kids get sick less often. It's the opposite of that myth. They actually get sick less often. And we've seen that, I keep using my own kids because I know them, but I've seen this with our patients too. They'll get sick, the typical childhood illnesses, but then they're better in a day or two. So their recovery time is much better. I continue to put a plug in for soy food. I think tofu in particular is a great snack for a school-age kid, especially if they've been introduced to it earlier in life. But it absorbs flavor, it's concentrated protein and fiber. You could hide it in things too, like for example, when I make macaroni and cheese for my kids, I make the cheese sauce out of vegetables and silken tofu. So it tastes very creamy, but it's much higher in protein. And that's another thing too. You can, kids are picky, of course. School-age kids might be embarrassed about having, all vegetables, and it looks too healthy compared to their friends. But you can easily hide vegetables and fruits in sauces and things like that. So that's one way to get like a more varied diet into your child. In red here, just what I continue to say. So plant-based kids, hopefully from the beginning, have been eating a more varied diet, getting more vegetables, more fruits, more nuts, seeds, more like whole food sources of nutrients. So they take in less sugar and they take in less saturated fat. And this is important because, as I mentioned earlier, already these lifestyle diseases are starting at this age. They've done studies where they're seeing plaque buildup in kids as little as 6 years old. So unfortunately, if that trend continues, one of the studies I read said they expect 1 in 3 children to become diabetic by the age of 12 in the next couple of years. So hopefully we can turn that around. And then finally, adolescents and young adults. Again, we continue to see the trend up of new diagnoses of diabetes, cholesterol, and other lifestyle diseases, hypothyroidism. And then we just heard an amazing lecture on PCOS. And also Dr. Rupa mentioned about the acne. These are great ways to get teenagers to adhere to a more plant-based diet. The acne thing truly is incredible. We've seen 2-3 weeks also. Their skin is crystal clear. PCOS, menstrual cramps. Kids this age are very in tune with their peers and outward appearances. So if you can get rid of their acne, it helps their mental health. It helps their school performance. So just in something as little as taking dairy out of the diet. And then, I alluded to mental health is a big deal in adolescents and young adults. So better physical health means less inflammation, less depression, less anxiety, less ADHD, better self-esteem, and just better home life, better school life, better performance. One thing too, and this would also apply to younger kids too, is if you have an athlete, you do need more protein than what I mentioned earlier. Again, plant-based protein, just as good, if not better. Usually not too hard to do. One other point, again, kind of going back to the mental health aspect of adolescents especially, eating disorders is a big deal in this group. So sometimes adolescents, both boys and girls, will decide to become vegan, and it's really a symptom of an eating disorder. So you need to make sure if your child is deciding to become vegan that they're getting enough calories, that it's not labeled as a diet for weight loss, but as an overall lifestyle change. So that's really important. It's something to keep an eye out. Next. So just a couple things. Kept saying over and over, it is not easy to do a plant-based diet for anyone, but particularly kids because of the different stages they go through. But if you plan properly and you keep everything varied, and you give, I should have put also a couple supplements, particularly B12 and probably vitamin D also. It's really important to make it inclusive and they will be just as healthy, if not healthier, probably healthier than their peers. So it's totally safe. And those are the actual children that I keep talking about.